Hello, friends. It's Dr. Lisa, nurse practitioner from the pediatric clinic, where kids are at the heart of everything we do. It's that time of year to talk about the importance of sunscreen and sun protection for children and adolescents. Skin cancer is becoming more common in young people, and protecting your child's skin from too much exposure can greatly reduce this risk. Sunburn during childhood has been linked to a higher risk of developing skin cancer later in life. Sunburn is a sign of skin damage that you can see, but invisible damage also occurs in all skin types. There are two types of sun rays that are harmful to the skin, UVA and UVB rays. UVA rays cause skin aging, skin cancers like melanoma, and UVB rays cause sunburns, cataracts, and also contribute to skin cancer. What kind of sunscreen to use? The American Academy of Dermatology recommends that all children wear sunscreen. Make sure that the sunscreen has the following characteristics. They're a broad spectrum, which covers against UVA and UVB sun rays, and that they're water resistant. Water-resistant sunscreens can no longer be labeled waterproof. They're now called water resistant for up to 40 minutes or 80 minutes. And that they have a sun protection factor or an SPF of 30 or higher. Check the front label of the ingredient on the sunscreen, and they should have one of the following ingredients, either titanium dioxide or zinc oxide. Those are the best. They tend to be thicker and provide better protection for your child's skin. How do you apply sunscreen? Well, you apply sunscreen to the exposed skin about 30 minutes before going outside, and then you reapply every 2 hours and after water exposure, such as swimming, running through the water fountain, or sweating. And then you want to reapply the sunscreen when outdoors in both sunny and cloudy weather. Sun rays still come through the clouds and can affect the skin. Also, make sure you check the expiration date on the sunscreen and look for changes in color or consistency. And if you have a change, you want to throw it away and get a new one. Other ways you can protect your child's skin. You can let them wear a hat or sunglasses or protective clothing and stay in the shade. They also recommend avoiding outside time between 10 a.m. and 2 p.m. when the sun are at their strongest, the rays are at the strongest. Look at your child's skin regularly. Look carefully over their skin for changes in their skin or new moles. And if you find anything that's new or different, make sure you talk to your child's healthcare provider about those changes. How do you protect young babies and infants? Well, infants have very delicate skin and are much more sensitive to the effects of the sun and the exposure and the heat. Sunscreen has not been extensively tested in the younger babies, so the American Academy of Dermatology discourages the use of sunscreen for children less than 6 months old. So they recommend that you dress your child in a hat and long sleeves and pants, using light fabrics in warmer weather, using car carriers and strollers with wide sunshades, and making sure you keep your child well hydrated to avoid overheating. Regular feedings with either formula or breast milk should provide enough liquid if you're keeping your baby cool. Keep your baby in the shade. For babies over 6 months, you can use a chemical-free sunscreen or sunblock that rely on ingredients like zinc oxide or titanium oxide, and they are safe. They're considered safe for this age. Remember, the pediatric clinic is here to partner with you in taking care of your little ones, so feel free to give us a call at 901-317-7958 to schedule an appointment. Kids are at the heart of everything we do. Thanks. See you soon.